The differentiation of white blood cells. So what we're looking here is at the neutrophils. They primarily target bacterial infections. Over 60% is considered high. Eosinophils target parasites, allergies, and an asthma response. Over 3% is considered high. Basophils create a histamine response for allergies and asthma. Over 1% is considered high. Monocytes respond to inflammation, and over 7% is considered high. Lymphocytes further divide into T cells and B cells, and over 40% is considered high. This is really important information. You guys are going to want to write this down. You're going to want to have this as a cheat sheet in your practice. Always remember, neutrophils primarily target the bacteria, over 60% high. Eosinophils, that's where you're going to have to kind of use other information to see what's going on, because it could be parasites, allergies, or an asthma response. So if you had somebody who had a low basophils but high eosinophils, what do you think they might have? They probably have a parasite infection, especially if they have elevated white blood cell count, or if they've been uncomfortable with a lot of digestive symptoms for a long time, they might have a chronic infection. So that's where you have to kind of look at, okay, if the basophils aren't high and the eosinophils are high, then it's probably parasites. However, if eosinophils and basophils are high, then you might want to look to doing a further stool test, because then you can't really tell. Or you can kind of go based on their symptoms if you know they have a lot of allergies and asthma. And that's one thing you might want to ask the person. Do you have allergies and asthma? I've had this come up actually in my clinic quite a bit, where I'll have the eosinophils and basophils and white blood cell counts high and the monocytes high. And I'll say, do you have allergies and asthma? I don't really see you having allergies and asthma. And they'll say, oh no, I don't. And I'll be like, I really think we need to do that stool test because you might have a parasite infection. That's one thing you can look at. And now monocytes respond more to inflammation. Over 7% is considered high. If you have somebody that comes in and they have, say, 10% of monocytes, and they have lower basophils and lower eosinophils, but this number is really high, the monocytes is really high, and the neutrophils is normal, anybody have any idea what that might be? Food intolerances. So that's where you're not going to want to waste time on recommending a food allergy test, because remember, the allergies are only going to show up when they have the elevated eosinophils and basophils. If it's elevated monocytes, you're going to want to look more at a food intolerance test. That's one of the ways you can see which one is going to be more beneficial to them. Now, you might have elevated monocytes because of high levels of inflammation due to genetic markers. One of the things that's really up and coming in the functional medicine field is using DNA testing through 23andMe to identify systems in the body that are compromised through gene mutations. That's something I'm doing in my clinic too, and that's, I think, really exciting. But you can see DNA gene testing, gene mutations that correspond to people that tend to have high monocytes in general. Usually these are people that tend to have a lot of digestive problems, digestive symptoms that are also in other family members. They have a family history of it if it has the DNA marker to it. If you have high level of lymphocytes, then the person might be fighting a viral infection versus high level of neutrophils is probably bacteria. So then you can start to think about which of the Chinese herbs and nutritional supplements and different things they might need to support them.